All right, what's happened here?
Dancing accident. I hurt my arm. I think it's broken.
Oh, yep, looks expensive.
Expensive?
Well, you'll need an x-ray, and those machines cost a mint. And then you'll have to pay for the technician's time over there.
Hello.
Okay. Plus there's the nurses and the receptionist, and let me guess, you want some painkillers as well, do you?
Oh, that'd be great, actually, yeah.
Yeah, treating people who are sick or injured can be really expensive. Although in Australia, it's not something you necessarily have to think too much about when you go to hospital. And that's because of something called Medicare.
Medicare?
Oh yeah, Medicare is a system run by the government that pays for people's medical treatment.
Oh, do I have it?
Yeah, every Australian has it.
Oh, who pays for it then?
Well, you do.
Me.
And me.
You see, we all kind of pay for it. Medicare is funded by tax. In fact, it takes up a fair chunk of Australia's budget every year. But that wasn't always the case. For a long time in Australia, most people relied on private health insurance. You'd pay a company money and they'd cover the costs if you got sick. While the government did have different systems to help people who needed it, they were complicated. And people without private health insurance could be up for some big bills. So, in the 70s, the government set about changing that.
We would want to have a single public health insurance fund.
That was the Prime Minister at the time, Gough Whitlam, who introduced Australia's first universal healthcare scheme in 1975.
Medibank, the new Australian health insurance program, is a healthy change.
But it was controversial and faced opposition from some doctors, private health insurance companies and the opposition, which said it was too expensive, discouraged competition and put too much control in the hands of the government. Medibank was scrapped in 1981, before being brought back in 1984 as Medicare.
That every Australian, from newborn babe to Prime Minister, can share in the cheapest, simplest and fairest health insurance scheme Australia's ever had.
While private health insurance companies still exist, Medicare covers a lot of essential medical treatments. For example, going to hospital with a broken arm. It also covers some or all of your trip to the doctor, depending on whether they bulk bill. Bulk billing is when doctors and other health workers only charge what they get back from Medicare, which means for the patient, it's free. But over the years, the number of doctors who bulk bill has been dropping. Doctors say that's because Medicare doesn't pay them enough to run their business. Some people reckon that's a big problem, because if going to the doctor is expensive, fewer people will go, and that could lead to more serious medical problems. It's why last week, the government announced a big increase in the Medicare payments that go to doctors.
By 2030, we want 9 out of every 10 visits to the GP to be bulk billed.
Then the opposition leader said he'll do something very similar if he's elected.
The coalition government is committed to $9 billion worth of investment into our general practice network.
That's the most money that's been spent on Medicare in decades. Although some say it still won't be enough to guarantee that doctor visits are free. Still, many are hoping it will have a big impact on hospitals, doctors and the health of our country.
I'm just so relieved I don't have to pay. I don't know what I would have done.
Yeah, well look, I hate to break it to you, but this is still gonna hurt.